The next muscle we're going to cover is kind of the last of our back muscles for today, or for right now, I should say. It is what's called an extrinsic back muscle. So it is on the back, but it doesn't really do anything for the back. It's not about moving the spine. It's an arm muscle. It just happens to be located in the back. Well, it's not by chance, I'm sure, but let me hide our trapezius. So we're going to talk about Latissimus dorsi. It's Latin. Make up your own pronunciation. Have fun with it. The lat, the latissimus, they call the bra strap muscle. Often, we jokingly call it the reverse Hans and Franz, because it's behind you instead of in front of you. This is the muscle that gets your arms to the back side of your body, essentially. That's why they call it the bra strap. To reach back and do that requires the latissimus. It's a weird muscle in that it originates on a big, broad structure that is all connective tissue. So if I don't highlight our lat on this side, you see this white connective tissue, fascia, here in this sort of weird arrowhead shape. That is what's called the thoracolumbar aponeurosis, or fascia, depending on who you talk to. This is connective tissue that ties a bunch of structures together. It connects our vertebra from the thoracic region down to the sacrum. It attaches the sacrum to the ilium all along that upper part of the crest around the PSIS and the sacroiliac joint. It actually connects to the lower portion of our ribs, the 12th, 11th, 10th or so. All of these structures connecting to the spine through this connective tissue. Also, all of our abdominal muscles, the obliques and the transverse anyway, both obliques and transverse, grab the same connective tissue on the back. It's the origin of the Latissimus dorsi. So if you look in your handout, it says the spinous processes of T7 to L5, the iliac crest, the posterior superior surface of the sacrum, and then it says all via the thoracolumbar fascia. All of those things that the fascia connect to are what the lat is pulling on, but it's doing it through that connective tissue. From there, it tracks up across the back. In many people, grabs the inferior angle of the scapula somewhat on its way through, and then its actual insertion is on the anterior surface of the arm. Let me hide a few things and move this model around. It's very similar in some ways to our teres major and our subscapularis, in that it's coming to that inside edge of the arm. It's again inserting on the medial edge of the bicipital groove, just below the head of the humerus. It's also twisting over itself. It's got that spiral and convergent quality that we're seeing is so popular in the shoulder. And because it's coming from the low back up to this area, it gives the lat all of its actions. So it's good at bringing the arms in, adduction. It's good at extending the shoulder, pulling the arm back. It's good at medially rotating the shoulder. And if we add that adduction, that brings the hands in. That's the bra strap. It reaches back, turns the arms, and reaches in. We didn't talk about it with subscapularis, but if you're seeing a reduction in range of motion and external rotation, and subscap isn't all that tight when you get in there, the lat is another one to deal with. I don't see it clinically as relevant. It's not as common for it to be lat that seems to be the problem as it is for subscap, with the exception of really active people. If you've got somebody who's a CrossFit competition person or Spartan racing and they're doing a ton of really intense body weight exercise, parkour or something like that, their lat may be more common, more likely to be injured, I should say. But most day-to-day activities, the lat doesn't have to work that hard. It's really that subscap that seems to take the brunt of it. Latissimus dorsi is a broad sheet of muscle. It's very hard to isolate with, again, the exception of where it rolls over on itself along this edge as it runs up towards the axilla, the armpit. So that's the easiest place to palpate it. It's another muscle that superheroes in the comics always have very well defined. And it is essentially the pull-up muscle. Right? It pulls our body up. So that's another way you'll see it often. A lot of bodybuilders, when they're doing their flex positions here, are pulling down to tighten that as well. So there's lots of examples. But that's our last posterior muscle for the shoulder for the moment, on the back, I should say. Next up, we are going to talk about the tricep. So we moved on to the arm officially. Hide lat and scroll down. The tricep is appropriately named. There are 3 heads, tri meaning 3, seps meaning heads, and brachii refers to the brachium, which is the upper arm. So the 3-headed upper arm muscle. Pretty straightforward. After that, less so, because they've named these terribly. There are 3 heads, and so each head has a name. What you would expect to be the lateral head, they got right. It's the lateral head. What you would expect to be the medial head is not. It's the long head. And if we fade this, where's my fade? There it is. The one that's underneath, that you can't barely even see right here, is the medial head. Not the deep head, not the distal head, the medial head. Even though it's not more medial than the long head. So, not my favorite naming structure, but it's what we got. So we'll work with it. So if we're thinking about the heads, the long head is by far the most injured, and it's because it's biarticulate. That just means it crosses 2 joints. It's the only muscle, or only head of the tricep to cross the shoulder joint. So the other 2 heads are only involved with moving the elbow, but this long head also moves the shoulder. Primarily it moves the shoulder through extension, right? Brings the arm back. It does a little assistance with adduction, but that's not really its main thing. If we peel off our rotator cuff muscles we've just finished, you can see that the long head is coming up and grabbing that infraglenoid tubercle here, right below the socket of the shoulder joint. So it's not got a ton of leverage in this position. And if we keep that in mind when we turn it, it's really not got a whole lot of leverage for extension of the shoulder. It has to work pretty hard, which is why it's such a big muscle belly in general. From that infraglenoid tubercle, it's going to merge with the tricep tendon, which is this whole connective tissue area, and it's going to grab the olecranon process, the tip of your elbow. The olecranon process of the ulna, to be proper. So that bump is part of this bone, not this one. So it is crossing the elbow joint. All 3 heads cross the elbow joint. And that is the closest to a kneecap that your elbow has. Right? The ulna has a projection off the back, and when you straighten it, it folds up into that little olecranon fossa, a little depression in the backside of the humerus, which we'll look at the bones here in just a minute to review. But the long head is straightening the arm and extending it, essentially. The other 2 heads just have the elbow extension. That's all they do. So they're much simpler. Our lateral head comes off the proximal posterior surface, which we can see here for the ulna. And then the medial head, that shouldn't be medial in name, comes off the distal ulna. So it comes up, or ulna, there goes my brain. The distal humerus, so the posterior surface. So the long, there goes the post-lunch coma of brain. The proximal portion of the posterior humerus is the lateral head's origin. The distal half of the posterior humerus is the medial head, and the long head is grabbing the scapula at that infraglenoid tubercle at the top. Let me hide all of these arm muscles for just a moment And we'll talk a little more about the bone, the humerus, and particularly the distal end, because we haven't done the osteology for that as of yet. So if we're looking at the humerus here, we'll hide some of the joint capsule, annular ligament, we don't need any of that. Anconius is a fun muscle. We'll get to that in a little bit. Just think, we have all of these left to cover. All right. So now we can just see the bones that make up the elbow. The distal end of the humerus looks like a dog bone, right? It bulges out like all long bones do. They changed the names, right? At the top we had two bumps. One was the greater and one was the lesser tuberosity. At the bottom we have two bumps, one medial and one lateral, but they call them condyles. Condyle means knuckle, so it looks like a bony knuckle sticking out. And the pointiest bit of a condyle is the epicondyle, on top of the condyle. That's what epicondyle means. So we have a medial and a lateral epicondyle, and as the bone flares out to become the condyle, there's a ridge, which, if you're sticking with all your anatomical terminology, there are these supracondylar ridges. So there's a lateral supracondylar ridge that's actually important, and a medial one that we don't really talk about much. When we get to the forearm muscles, that lateral supracondylar ridge will play a big role. We can also see that olecranon process in an extended position. It's tucked into the fossa on the back of the humerus here, but it is an extension of that ulna, which we can highlight to make that obvious. Good deal. Why don't we finish up by palpating latissimus and tricep, and then we'll come back and talk about some of the anterior and medial arm muscles after that. The latissimus dorsi attaches to that thoracolumbar fascia. Thora referring to the thorax, lumbar referring to the lumbar spine, co meaning width. So it's attaching to all of this area from the lower portion of the thoracic spine all the way down to the sacrum. So right down the midline here. It's attaching out along the crest of the ilium, and then it's coming up like so, grabbing onto the bottom few ribs here along the way. The latissimus is coming off all of that by default because it's pulling on that fascia. And it's going to wrap up, catch that inferior angle of the scapula, and then tuck under the arm, hitting forward here. Most of the time, this posterior edge of it, as it comes up towards the axilla, is the best way to isolate it. You can feel the edge of it down here somewhat, but it's a very thin muscle on most people. If we're going to use the arm to make the lat pop up, there are lots of ways to do it, but we know that the bra strap kind of action is what it does. So in this position, all she has to do is push up to the ceiling with her hand, and she's firing her lat. She's compensating a little and trying to lift the whole scapula. That's really pretty normal. But we can feel this muscle tighten and relax, and if we come up here and press in against the edge, we can feel it stand up. You can see right here the very anterior edge of the lat. Remember, it's coming to that bicipital groove, the medial edge of it, below the head of the humerus up here. So if you feel that groove, you can feel it tighten there as well when it's fired, but in this position, that's a little less comfortable. Coming off the thoracolumbar fascia, up and across this way. So we mentioned that triangle auscultation up here. The fibers of the lat that come off this upper bit, because it comes some from here and some from here, they make that one border of the triangle of auscultation. The fibers of the trap, which overlap and come up this way, headed for the spine, make the other border, and the teres major here makes the third. So our triangle of auscultation is right in between those. So if you're ever trying to find out if someone has pneumonia, you can stick a stethoscope there. Interesting facts for Jeopardy. So that's our latissimus. Then we're going to move over and start on the upper arm here, and we're in the perfect shape, position rather, for the tricep. We've got her prone. We know that there are 3 heads. The long head we felt the tendon of up here crisscrossing through our teres, and it's coming to that infraglenoid tubercle that's really not palpable in most people. And it's headed right here to the olecranon process. So if we bend the elbow a little, the olecranon stands up. That's right here. There's a little fossa above it you can feel, and that's what the olecranon rolls into when the arm is straight. With it bent, you're over the tricep tendon, which joins all 3 heads of the tricep. If we want to feel just the long head, we don't want to do any extension of the arm, of the elbow, because that'll fire the other 2 and make it hard to isolate. So I'm going to bring her arm out. I'm going to come in where I'm pretty sure the tendon is. And instead, I'm going to have her keep her arm bent, but push her elbow up towards me. And you'll feel it contract in there. And relax. One more time. There's good. Right on top of it there. Relax. So that's our long head. And it's the bulk of this medial portion here. Because we have 2 heads on top and 1 hiding underneath. So we can't directly palpate that medial head very well. It's buried. But we can easily palpate this lateral head. As long as we're not pushing through deltoid at the top end of it, all of this lateral portion is tricep. So I'm going to hold her wrist. I'm going to press in on the lateral side of the posterior arm, and I have her straighten her elbow. And you feel it stand up. Relax. Straighten again. See them both fire. Relax. Often you can find a little bit of a cleft between those 2 heads, particularly when the person tightens. It kind of pushes your fingers up and out of that cleft. Some folks will try to go around the 2 here and feel that medial head. I have terrible luck on almost everybody actually feeling it. It's just not that accessible. But you're working it anytime you're over the distal half, because that's its origin. And then up here, this proximal half is the lateral head.